Okay, let's just talk a little bit about skeletal muscle fiber types. We have slow fibers and fast fibers. We also sometimes refer to them as white fibers or red fibers. So white fibers are fast twitch muscle fibers, and red fibers are slow twitch fibers. So fast twitch fibers have little myoglobin, they have less mitochondria, so they're fast because they're used for power and speed, but they're only good for a short duration. They fatigue easily due to the buildup of lactic acid. Red fibers, these are the slow twitch fibers, they have increased myoglobin, lots of blood, that's why it's red, lots of mitochondria. They're used for endurance and posture. Since they're used for a longer period of time for endurance, they have more blood, more mitochondria, they appear red. So we're going to have these in a lot of your postural muscles, a lot of muscles of the back and calf. White fibers are more for power and speed. So fast fibers contract very quickly. It's used for a strong contraction, but they fatigue fast, where your slow fibers, they have lots of oxygen supply, they contain lots of myoglobin, lots of rich blood, lots of oxygen, they fatigue slow. So then let's go back for a second here and just look at white muscle and red muscle. We talk about chickens for a second. The chicken that ends up on a plate if you're a carnivore, okay? So if we look at the breast is white meat, and the leg, the chicken leg, is the dark meat, right? Chickens are walking around using their legs, so the legs need a lot more myoglobin, a lot more blood. They're not using their flight feathers anymore. They're not flying in the air like regular birds, right? So the white meat, which is the chest, same thing with turkeys, right? There's always that big debate. If you have turkey at dinner, who wants the white meat, who wants the dark meat? Now you have something to discuss at the next Thanksgiving dinner if you celebrate with turkey, understanding the difference between dark and white meat. Humans, we have mixed fibers. We have mixed. So sometimes we call them pink. Muscle hypertrophy is when muscles are used over and over and over and over, and the muscles grow in size and they get thicker. Muscle atrophy is when they break down. Between the ages of 30 and 50, about 10% of our muscle tissue is replaced by fibrous connective tissue and fat. Between 50 and 80 years of age, another 40% of our muscle tissue is replaced. So what ends up happening is that the muscle strength and flexibility decreases. Reflexes are a little bit slow, so be patient. When you see someone old in front of you and they're driving slow, don't honk them. Understand that they're doing the best they can, right? Everything's moving slower, their reflexes are even slower, okay? So what ends up happening as people get older, they start breaking down their protein for fuel. They may not be eating as well. So what I like to do with my patients is I know they need supplementation of protein when I see sarcopenia or muscle wasting. I call these hills and valleys. If you look at the back of the hand between these are the carpals. You could see the metacarpals here. These are the extensor digitorum tendons, but you could see the wasting and the atrophy of the muscles between. That's sarcopenia. This is the type of individual that needs protein supplementation and probably digestive enzymes as well to go with it to help break down those proteins as well.